No, Dr. Hussain, do you propose that we give it another couple of minutes so that we get the other people online, or do you want to carry on?
Yes, maybe 2 minutes.
Okay, let's give it another 2 or 3 minutes and then we can start. Thank you. Dr. Hussain, do you propose that we wait another couple of minutes because we don't have anybody from the Department of Health on yet, or do you want to continue? Dr. Hussain, you still muted.
Yeah, we can just give 1 or 2 minutes because I'm waiting for a Department of Health representative here.
Okay, so let's give it until 10 past 2. Is that okay?
No, 2 minutes more.
2 minutes, okay, 100%. Dr. Hussain, I'm handing over to you now.
Hi, good afternoon. On behalf of South African Medical Association and the National Department of Health, a warm welcome to all the medical students, interns, community service doctors, and other distinguished healthcare professionals. Thank you for joining us. The placement of intern and community service doctors is not just a matter of administrative logistics. It is a reflection of our commitment and providing quality healthcare to all South Africans, regardless of where they live. It is about the nurturing the next generation of medical professionals who will carry the torch of healing and compassion in our healthcare facilities, both urban and rural. On 20th of December, we met and the meeting took place between SAMA and National Department of Health to discuss the pending placement and swap application. During the meeting, the NDOH engaged with the provincial department, and it was resolved that NDOH will only consider swap application under certain situation, which the national department will elaborate as we go in today's meeting. Medical students and interns are encouraged to use this valuable opportunity to understand the changes that have been agreed to, and if there are any questions, please make use the Q&A box, and we will take all those questions from there and ask National Department to resolve and answer. I would now like to introduce from the National Department of Health, Mr. Victor Canele, who is in charge of ICSP and the Deputy Director General of National Department of Health, and also Dr. Luboye Bayani, who is our own SAMA leader. Now he is representing Department of Health as a Human Resource Director, and he is a health activist from SAMA. From the National Department Health, the floor is yours for National Department. Please come in.
Dr. Hussain, the people from the Department of Health are not online yet. They're not in the meeting yet.
Apologies. This is Victor Kanyile, and the last I checked, I am from the National Department of Health. Over.
Yeah, Victor is on.
Apologies. Yes, I think you logged in with the incorrect link because it says Dr. Zianda.
Dr. Zianda. Oh, okay. I just got the link sent from Sama. My humble apologies. How do I correct it?
Victor, you are most welcome. Please take over the floor.
You can just rename it on your side.
Let me see. I'll try. I'm not good with that, but I will try. How do I go? Where do I go?
I did it on my side, so you can continue.
Oh, on my side is written Mr. Victor Kanyile.
Yes, I just changed it to that now.
Oh,
you can continue.
thank you.
Thank you.
So what's expected of me now? Hello?
The follow-up the placement and remaining application with the swap issue and those who haven't got place, and the social compet issues, and those who are still waiting for placement. Those are the challenges we need to discuss. Thank you, Victor.
Okay.
Mr. Kanyele, sorry for the interruption. Can I just ask you to enable your camera as well?
Hey, I'm actually working from home, and I'll do that soon. So tell me, I'm not sure. I haven't been briefed how the process will unfold. Is there someone who can quickly brief me? I just got told I must join the meeting. I don't know if everyone is online, how many people are on site, who am I having a meeting with? Is it possible to get a brief at least? I just joined now.
Okay, Victor, we did wrote an email, and when we had the meeting 2 days ago, we agreed this webinar to update our member and those applicant, the SAMA member. Basically, we are giving the feedback, what we agreed, what we have discussed previously, and what is going forward will happen. Those who haven't got the placement, those who haven't got the swap, and those are pending issues of internship and community service. So, and the provincials are still not signed up with the exchange program. So those are the challenges. We need to update our member. There are about almost 65 member on the line. They are all doctors, interns, and community service.
Thank you. I think that's actually clarifying. I really do appreciate. My humble apologies that there might be some emails that are falling out of sight. The reason being that we are inundated with emails which are not appropriately sent, particularly individuals, who would send directly emails to us instead of sending them to the email address called icsp@hai.co.za, where we guarantee a 72-hour response. So the reason being that, we are continuously engaging either in meetings or working as a group, and therefore are not attending to, our own emails in order to ensure that we finalize this particular process to the best of our ability and also in time. Dr. Hussain, Thank you. I'm trying to enable my video as I was asked, but I see I can't. So I'll therefore have to continue as is. You have made a number of statements, and I'm going to piggyback on them. The first one was the issue of allocations. I can to date confirm that we've allocated all eligible applicants for medical internship and community service to date, who are South African citizens and permanent residents. All of them have been placed in funded posts and are expected to commence duty from the 1st of January, but we extended them. We made sure that we allocate also those that can start 1st of February, particularly those that are community service doctors. The rest of the applicants who can start later, we will be allocating them in January, making sure that, you know, if there are any issues to manage, like moving from one area to the other, they have been given an ample opportunity to do such. In our process of determining eligibility, we realized that there are some doctors who are still finalizing their studies, either will only be able to commence duty in the media cycle, and therefore they have lost, positions to be allocated due to the fact that they will only be validated and their eligibility will be on the 1st of July. We do have colleagues that are South African citizens who studied abroad, and they have since got in touch with us through the ICSP online. And in order to make sure that they get their fair chance of being allocated, we have indeed, engaged Health Professions Council of South Africa in order to know their current status that assures their eligibility. Those that have passed both the theory and practical have been allocated, but we didn't stop there. We went further to ensure that those who passed the theory but were due to write the practical now in December, we are located in position on condition that if they are certified to have passed, then they will be given an ample opportunity to start. However, if they are unable to, they will be removed from positions, and they will be given them again as soon as they are declared eligible by HPCSA. I don't know if I can stop there so that I can take questions regarding the issue related to allocation to positions, because there are issues that varies from one another, and I would like us to engage with them as and when we continue. Can I pause there? Over to you, Dr. Hussein and colleagues.
Yeah, thank you, Victor. Yes, I think we need to engage, and there's a lot of concern and questions. So the one of the question is swap approved, how long they have to wait, or all the swap have been approved. The other issue is from Limpopo for community service. Those are the two questions at the moment. So you can take those two.
Yeah, I actually avoided talking to swaps because your first or one of your statement was people still are waiting to be allocated. So meaning there's an allegation that there are people who are not yet in positions. So I wanted us to address that because according to our statistics, as well as our information, all South African citizens that are eligible and permanent residents have been allocated to positions. The swaps is one part process, but different from the issue of allocations. Can I get a confirmation if SAMA has got a list of any individual whom is eligible and is a South African citizen or even a permanent resident, but not fully have been allocated into a position?
Thank you, Victor. And we do have a list, so we are comparing those lists. We will share with you. If any other want to have a question there.
Dr. Hussein, I think the question has not been responded to, the one regarding Limpopo. If you could read it as it is, and then we get a response.
There's an issue. There is an issue in Limpopo province. Some community service doctor received an SMS that they are placed in Limpopo, but in this week the list went out in Limpopo, and some of the community service doctors were not on that list. When contracting Limpopo, the coordinator were very rude and says that they don't have money anymore for all the posts, and therefore those doctors not on the list lost their job or placement. Will National Department of Health address this? Victor, over to you.
No, thank you so much. Yes, now that is indeed a question related to allocations, and I welcome it. May I take also this opportunity to greet Dr. Mvuisi Mzukwa. And
Hi, Dr. Kanyile. Hi, Dr. Kanyile. Thanks a lot, man.
Thanks for joining in. Thank you. I can confirm that that particular incident, which is related to Limpopo only, was at least brought to our attention, and we have since resolved it. I'll give you what the challenge was. There are a number of positions that are allocated, and they are funded in two pockets. There is a funding that comes from the equitable share of the province, and the other is coming from us as the Human Resource Training Grant, amongst other funding that we lobby as the National Department of Health to ensure that we do not have eligible doctors that are supposed to go through this statutory program and remain unallocated. So Limpopo misunderstood the communication where we inform them that additional to their funded, we need them to identify areas of need, particularly underserved areas and rural areas of 10 positions, which will be funded from the National Department coffers. So instead, they actually calculated that we wanted to send them additional positions that they will be funding from their coffers. We have since engaged the province appropriately, and that matter has been addressed between us and the provincial office.
Thank you, Victor. The next question is, so will those who were due to start in February will be placed in January?
No. Let me refer to a point that I made. I have informed that all applicants who are eligible to commence duty from the 1st of January up until the 1st of February have been allocated to positions. The only people whom are still to be allocated are the ones who can only commence duty from the 1st of March going forward. Those will be allocated in January to make sure that at least they are informed a month before they can commence duty and make informed decisions in this regard. Over.
Okay, thank you. The next question is, there is also an issue in the Northern Cape. The Northern Cape coordinator told some of the community service doctors who did not receive their appointment letter yet that they are nationally funded and they have not yet received any word whether the posts are actually funded. So the NDH addressed this issue for Northern Cape. So the doctors are not receiving letter, and there's a confusion about funded post or non-funded post. Victor, over to you for the Northern Cape.
Thank you. Again, this is also one but position which was similar. One can say it's a similar challenge with Limpopo. However, colleagues, I mean, we had a meeting today which just, I mean, it's still on. I just had to jump off to join this particular meeting where we were telling them how the funding works. The funding means that the information that they collate at the provincial level needs to be submitted to national department, and we agreed on a particular date, which is Wednesday, where the process of employing these people will happen. They will be employed at national level, but seconded to the provinces, those that are funded from our coffers. The reason is that in terms of the treasury regulation, you cannot transfer money from one department to the other. We will be in trouble, and we are avoiding, unnecessary audit queries or findings in this regard. So those people still remain allocated in those provinces. They will be appointed nationally and seconded to those particular provinces.
Oh, thank you so much on that. And the question is, if we email to ICSP, we are ignored and no one is answering the phone. Is regarding ICSP.
Thank you. I think if you don't mind, Dr. Hussein, I would appreciate that. Let's tackle the issues that are related to the process, and then we can take this kind of general questions at the end, so that when we're closing up, because that is a general matter. I would want to address the issue related to swaps, if colleagues do allow, as a sequence of events that have occurred, and also update the progress to date. Colleagues would recall that in terms of us knowing that we are unable to allocate everyone in their 5 chosen posts, we made a provision for those that are allocated either outside their 5 choices or even their provinces to try and swap with their peers. We since developed the SOP with the assistance of associations, including Inclusion Summer, and the process of swapping did commence with specific dates that were set. And we appreciate that colleagues did, adhere to the call and have since, tried to swap accordingly. With the swapping process, the provincial departments of health were supposed to assist in approving and considering swaps, as they are the recipients of the applicants in this regard. There have been a challenge whereby a number of cases have since been dealt with by provinces. However, we had a record of certain cases of swap which were remaining unattended to, or for the lack of a better word, still awaiting approval or consideration. In our meeting, which was held on Friday last week, an informed decision was taken in deliberation with provincial departments of health that all cases of swaps that have been received by provinces must be finalized by end of business last week, Friday. Failure of which, the National Department of Health will use its discretion to take over the process from Monday meaning this Monday that started yesterday, where we were taking over to only consider cases that are remaining unattended or awaiting approval from provinces. The reason for that was we wouldn't want to further delay any process which would delay the next step, which has since opened, which is the appeal process. Now I'm going to give a report on the progress made to date. We have attended to all the cases that has came to our attention in two folds. One, where provinces have attended to the matter, either approved or disapproved. We have updated the information accordingly on the list, and the changes where necessary have been made, and the information has been sent to various applicants on their status, as well as the list to all provinces. We acknowledge that at least there are still about 30 cases that we're awaiting approval from provinces. We are just validating the challenge from each province. I'll give an example in this regard so that I'm clearer. I am allocated in Limpopo. My peer whom I wish to swap with is allocated in KZN, my hometown. I have completed the form accordingly on the required dates. My peer has also equally completed the form, and we have since handed it to my coordinator in Limpopo. The Limpopo coordinator has approved, but we still await KZN to approve. We said that case is being taken over by National, and National will deal with it. So what we are doing in these cases that are left, that are less than 30, is to first verify that neither of the two applicants are bursary holders. Number two, we are trying to get information from KZN for reasons of delay. They might have reasons which are unknown to us. So before we apply an approval, we need to know if they have indeed an issue with not approving. So that is taking quite a bit of time, but we have since had a meeting, and we have made an informed decision that by end of business today, all those swaps would have been attended to. We also acknowledge that there might be a challenge where we are not aware of such a swap, and we request that colleagues mustn't send documents individually to us on our emails. There is an email address called icsp@hai.co.za, where we are guaranteeing you the 72-hour response. The 72-hour response might be in twofold. The first one might be an acknowledgement of your email and giving you a ticket number and stating that your case will be attended to. So it being attended to, it means it will be sent to the section that is appropriate. If it's an issue related to the swap, colleagues who are working with swap peer review will then receive the case and deal with it. If it's an issue related to other matters like your allocation, or you've forgotten something, or you haven't received an WhatsApp or an allocation letter, it would be sent to that section where you will be assisted accordingly. We have taken that decision to finalize those swap today, and all letters will be sent accordingly still today. In our meeting, we also engaged on the issue of contracting or providing offer letters. The first part is about offer letters. You can't contract a person legally if you haven't received all the documentation that validates their appointment. We are talking here about those that might be still waiting for their results, or they still haven't submitted documentation that are required for appointment. those are advised to indeed engage their facilities so that this process can be finalized at their earliest convenience. We acknowledge that, yes, indeed, those that are waiting for swaps might be saying, I'm still not have received the latest. I therefore would wait until I get a reallocation or my response on the swap, and I will take a decision thereafter, meaning going to the facility. So those are the processes that might be delayed, but we humbly appeal to all colleagues that in this regard, by Wednesday, because Monday and Tuesday are regarded as public holidays, but at least by Wednesday, they should get in touch with those facilities because at that time, the process of informing them would have been finalized. Colleagues, we have since opened the appeals on Tuesday, and to date, I can confirm that we have received 180 cases of appeals, of which at least 25 are duplicates, and we are now verifying the information. It might be a duplication because someone has added some information that they might have forgotten, or maybe an error from the applicant's side. So we have been dealing with that in order to eradicate those challenges related to appeals. In terms of the appeals, we've got an SOP that we've developed, we've circulated it. The appeals can only be done through a link where a person who wishes to appeal would click on the link, enter their details, give a short brief, why are they appealing, and when necessary, download documents. There is a part where you are able to download the documents or additional information. We humbly request that colleagues who wish to appeal must familiarize themselves with the SOP so that their case is indeed meeting the eligibility of appealing. In terms of the process, from to date, we will be starting, if we are allowed to get to work and not sit in webinars. That was on a lighter note. We will be screening all the appeals, where I'll give an example again so that we all understand. Where the matter is urgent, no, sorry, not urgent. Where the matter is simple to can complete, during the screening, the department has got the discretion to finalize it. The example one might be where Dr. Akhtar, who is allocated in Limpopo, Victor, who's allocated in KZN, the two tried to swap, but Limpopo approved, KZN disapproved for reasons that they have stated, but the two still feel that the matter was not dealt with fairly. The National Department of Health can approve that case, not to delay the applicants. I think it's a straightforward case. Another issue might be where, because the two facilities are not losing, they are both gaining an individual who will commence duty. It is indeed a straightforward case unless proven otherwise. So those cases will be finalized during screening, and only those that are maybe reliant on availability of resources, and there is complication in terms of dealing with the matters, they will be referred to the appeals committee that has since been appointed by the DDG, and they will be sitting on the 8th of January. Colleagues, there is a catch-22 situation in this regard. For medical interns who are willing to wait for the appeal process, there might be a challenge because in terms of HPCSA regulation, they are required to commence duty on the 1st of January, and they will not be allowed to commence in the middle. So it might mean that that individual can only start their medical internship on the 1st of April, after the 3 months rotation period. It is indeed delaying the people's, start date. However, it is a regulation that is beyond our control. However, for ComServe, where we are the determiners, we will indeed assist them accordingly. It is expected that all those cases will be dealt with as and when they come, and provinces are given or will be given a link today as per our discussions earlier, where they will be seeing people who are allocated in their facilities but have since requested for an appeal. I will stop there for any engagements or questions on these two issues that I've since mentioned.
Thank you so much, Victor.
Yes, Dr. Hussein, over to you.
No, you carry on. You carry on. Two issues.
No.
We are waiting for two issues.
Yeah, these two issues, which is related to swaps and appeals that I've dealt with. There might be comments, questions, or points of clarity that are required from your side. Over.
Thank you so much, Victor. Yes, you cover most of the swap issues, and especially the challenges in KZN. As you said, one province signing, other provinces still not signed. So now national will take over those cases. And the challenge in KZN, Department of Health is not responding to the applicant. So that needs to be tackled by National Department of Health also. So the only one issue is if the appeal process delay for 1st of April, because HPCS is only sitting on the 8th of January. What is the best solution here? Victor, please, can you explain that?
To be honest, Dr. Hussein, the best option is that we encourage colleagues to take up that position so that they don't delay advancing to the second level of their career, which is community service. But we acknowledge that sometimes there are certain conditions that makes it impossible for the individual, to take up that position. And unfortunately, we'll have to indeed bite the dust because we have to adhere to regulations in order to make sure that we don't find ourselves wanting. Hence, in our appeals SOP, we are still putting a plea for applicants to at least consider, taking up those positions where they are able to. Over.
Thank you. The one other important, if they reject their placement for January because they didn't get their choice according to where they wanted, or the swap didn't happen, if they don't accept at all, what will be the process after that?
Colleagues would recall that the reason we developed an ICSP online system was to make sure that the process is fair, transparent, and equate. It is indeed not meant to be a punitive system. We don't want to punish any person. So the people won't be punished by the virtue of them rejecting positions, but they will be welcomed to apply in the next available cycle. Remember, there is a difference between appealing and rejecting a post. If you appeal, you will be looked at, and if resources do allow, you will be your appeal will be approved considerably. But if you reject, that means you are saying, I'm not available anymore. I can only wait for the next coming train, and therefore the train will leave the station and you will wait for the next train. Over.
Thank you. So the colleague, they need some clarity. Closing date for appeal, it is on the website will be 22nd to 29th, or there's a specific date for closing for the appeal. And also like to know regarding the Limpopo issue, when can the doctor expect communication from Limpopo for the placement?
Yes. With regard to the appeal, we've stretched it a bit. We said the closing date is the 29th. I think we are being quite generous to the fact that, you know, people might still be trying to make decisions and still, you know, not sure about the decision. So we think it's only proper that you give them a reasonable time. As I've said, that this is not a punitive system. With regard to Limpopo, indeed, communication will be sent out on Wednesday, both to the individuals and also on the association website, so that, I mean, people are aware of the developments, like we have tried to do, that on a weekly basis, we update our platforms accordingly. Over.
Now, thank you so much, Victor. I think almost all the questions you have covered, and I just wanted to share our if they are not able to get login in ICSP or appeal process, can they also submit to SAMA so we can also help and directly submit to you with your email address or link? Over to you, Victor.
Yes, we really do appreciate, you know, the relationship that we have since created with the associations, particularly SAMA, that has been so instrumental in assisting us to deal with the challenges we're having with our applicants, and we welcome all the assistance. I think, you know, on Tuesday as well, we reiterated the importance of working together, and we welcome all the ways that we can assist. I also appreciate that, Dr. Hussein, there are certain areas of questions that you receive from yourself, and without wasting time, you do address them with us, either through our platforms or even email or calls. I know that unfortunately not always available to answer to the calls, but if you drop me a WhatsApp, I will definitely attend to it as soon as I'm done in the meeting or in whatever engagements that I'm in. So we do welcome your assistance, and we will definitely work together to achieve more.
No, thank you so much, Victor. We do get inundated with the phone call and queries and questions, and we, as you know, we already done a short survey, and we already shared with the Department of Health and Dr. Boyani. So what we'll do, as they are applying to ICSP and National Department, so they can also, because they are our member, they can submit to SAMA, our team. We will prepare the document and submit to you, so nobody get missed out. And it will help fast track, because these few days, holidays, we don't want to be our member to be in distress and anxiety and can't celebrate Christmas and New Year's. So if no other question, the last question is, Eastern Cape is also facing the similar like KZN swapping issue. So we need to look at those challenges in Eastern Cape. Victor, over to you.
Yeah, you know, colleagues, I have to be honest with you that we realized that there were a number of challenges where, I mean, in our meetings, we would specify cases. We would say, Eastern Cape, tell us all your cases that you have received by name of the person, the ID number, and the facility where they are located and where they are wishing to swap. They would state and they would say, we have approved from our side. We have sent to the coordinator in the other sister department next door, either Western Cape or any other. And we would say, okay, the other province, can you respond? And the other province would say, no, I've received it, I've signed, I've sent it, I've emailed it back. So we realized that indeed there has been network challenges where emails are bouncing between the provincial coordinators. Hence, we took an informed decision that we are not going to delay our applicants because of the network, load shedding, or any other matter. What needs to be done is that as they send it to the other province, you must copy national, because national is an overall responsible department to ensure that this matter is finalized. So we are aware of those. And as I've said, they've since been elevated uniformly at national level. And I've stated that we've got only less than 30 cases that we are finalizing. And we are confident that those cases will be finalized today and that we're still awaiting approval. Over.
Thank you so much. So if we can share again with our member, your appeal links and closing date and things, so we can update our member. We will send the email, med-email, and explain exactly what we have discussed, whoever missed from this Zoom. And also those members are on the Zoom and the colleagues, please join summer membership so you can have a easy access to get all the information. And thank you, Victor. I will now hand over to our national chair, Dr. Muyusi Mazukwa. He will be doing the closing and his remarks going forward. Thank you so much, Victor.
Thank you, sir.
Mazukwa, chair, please come in. Floor is yours.
Thank you so much, Dr. Hussein, and thanks to Mr. Kanyile for this engagement. And I would also like to thank all the attendees on this virtual platform, where we are trying all our best, that your issues are resolved, but also that you don't find yourself not knowing what to do. At least you must all know that there's a South African Medical Association that is there to assist you. All you need to do is the host can put up the email, summer email there, so that if there's any questions, people can be able to send their queries there. But otherwise, thanks to Dr. Hussein for facilitating this and also this collaborative work with the Department of Health. We hope that allocations will be dealt with, and hopefully by next year, we will be having a smoother process where we can allocate, timelessly and without any glitches that we are having at this point in time. Otherwise, from my side and the South African Medical Association, we wish you a Merry Christmas and a very prosperous New Year. I hope to see you soon on further engagement. Thank you so much.
Thank you very much, Chair. Thank you, Victor. Thank you, every member on the line.
Thank you. Just one closing remark from my side. If there are any other further webinars that would be arranged, maybe next week, please be assured of our availability. And my humble apologies about today. We had a number of lined up meetings that I thought we would have done quite quicker with the provinces, but I need to make sure that there's due diligence and appreciation of the process, because I wouldn't want to see any applicant being distressed, similarly to what Sama has or the president has just mentioned. Thank you so much, colleagues.
Thank you. Thank you very much, Mr. Kanyile. Thank you.
Okay, bye.
Thank you very much. Have a nice Christmas.
Bye.